Everyone is doing their part in helping the community at this time, and Angela Scott, our Northern correspondent, talks with a doctor who's doing his part.
We're all hearing how the coronavirus is impacting the medical field, but how is it impacting the dental field? Joining me today is Dr. Jason Campbell. Good morning to you. Thanks for being with us.
Angela, it's great to be with you guys this morning, and thank you for coming and visiting with us.
I was really looking forward to doing this interview because, it's something that, someone's at home, they have a tooth that's just killing them. What do they do right now?
Yeah, it's scary, that with the pandemic, everything that we're experiencing with COVID-19, obviously, people are starting to become nervous about getting access to care. In the field of dentistry, we're becoming limited on the procedures that we can provide for the safety of our team and for the safety of the community. So as that occurs, as people have limited access, they start to wonder what to do. My big fear as a dental practitioner is I'm afraid of the impact that it'll have on our medical industry and our local hospitals, and the impact on their precious resources that we may need in this area to help people, suffering with the pandemic on top of all the other medical things.
Sure, and we were just talking about that statistic that here in Arizona, a non-pandemic state, right?
Yep.
Every 14 seconds, someone is entering a hospital with a dental problem.
Exactly.
So you want to keep them in the dentist offices, out of the hospital, and keep the hospital, for those that really need it for other issues.
So if you can imagine that many people going to the emergent care system in our hospital setting, you can imagine what will happen in a shortage of care if people can't get access. The rush on the hospital may become very overwhelming for them. And what we want to make sure is that people understand there is a resource, that people are being creative in providing access to care so that people can get the answers that they need to their problems in the safety of their own home. It gives us as clinical care providers the opportunity to triage and figure out, is this something that's necessary? We don't want to bring people to the office and increase our risk factors here until we know that their care is needed, or is it something that we can put off and give them solutions of things that they can be doing at home rather than putting themselves and us at risk.
And I have to tell you, if someone does have to come in after you do the triage and you evaluate them and you see that they do have to come in, my cameraman and I both felt very safe coming in here today. You're taking all precautions. We signed waivers, washed our hands. So I really appreciate that, and I do feel safe here. It feels like a safe zone.
Yeah.